The disorder I chose was PLS. PLS is a motor neuron disease. It affects the upper motor neurons, which slowly breaks down the cells. I chose this because a few years back, my uncle was diagnosed with PLS. And they thought first it was ALS because a lot of the symptoms are the same, like stiffness of muscles, the speech is slurred, and they have difficulty breathing. This is a rare disease because there isn't a lot of information known, like ALS. It is hard to get a proper diagnosis. It took my uncle 10 years to get diagnosed correctly because of all the treatments and symptoms that he had was really close to ALS. But ALS affects the upper and lower motor neurons. And since his issue was it only was affecting the upper neurons, that's how they determined that it was PLS and not ALS. It is typically found in people over 50, but children can have this too. Mayo's Clinic said that there's a mutation that can affect the children called ALS2. Researchers aren't quite sure how this gene causes PLS, but it's responsible for creating a protein called acetylin, which affects the motor neurons to become unstable. It could also be because it's an autosomal recessive disease, which means that it's carried by both parents and that was from primary lateral sclerosis. There really isn't a treatment or a plan to stop PLS because there isn't a lot of information out on it. The focus is how to stop the symptoms that is affecting the patient. Medication is used to help the muscles relax more. And they also use physical therapy to get those muscles working better and changing the range of motion. The life expectancy does not get shortened when you get diagnosed with PLS, but it can decrease the quality of life because the person would be in pain a lot because of the muscle crampness and spasms. Since it's really similar to ALS, a lot of people are getting diagnosed with ALS when they might have PLS because the symptoms are the same and they both affect the upper motor neurons. So you could be showing signs of ALS but really have PLS. This can be a very painful way to live for the rest of your life if you are diagnosed with PLS. Thank you.